And welcome to the Dr. Bob Show. We'll be spending most of this show talking about recent advances in the diagnosis and treatment of Alzheimer's disease. My guest is Dr. Monica Crane. Dr. Crane is the medical director of Genesis Neuroscience Clinic. She has spent all of her life teaching and helping people that have Alzheimer's disease, both in the diagnosis and the treatment. And there are some new findings that you'll have an idea of what can make your life easier and understanding easier. Hello, I'm Dr. Robert Overholt. I'll be your host for the next 30 minutes on the Dr. Bob Show. Later on, we'll be talking about a wonder drug, a drug that will be easy for you and difficult for you. It's one that we may have been exposed to for a long time. And later on, why do people not respond to sinus infections? Could it be your microbiome? Is it that probiotics are needed in your case? And do they help? And which ones? A lot of information for you. You'll want to stay tuned. We're talking with Dr. Monica Crane, board-certified physician, medical director of Genesis Neuroscience Clinic, has spent her whole life on Alzheimer's, and she's got great information for us. Monica, welcome to the Dr. Bob Show.
Oh, well, thank you, Dr. Overholt. Glad to be back.
Can we define Alzheimer's disease?
Absolutely. So Alzheimer's disease is the most common dementia subtype.
So when you say dementia subtype, what do you mean?
So the word dementia is an umbrella term. There are many different dementias under it. And the word dementia just means a neurodegenerative disease. So that
neurodegenerative.
Which means a degeneration of the brain that is progressive and causes impairment in your daily life.
So there are several kinds. Where in that group is Alzheimer's the most common?
Yes, it's the most common, and it's about 60 to 80% of all dementias in the U.S.
So it's a real problem. Is it a problem in this viewing area?
Yes, unfortunately, the CDC just came out with a new statistic. Across the U.S., Alzheimer's has increased in death rates by 55%.
So more and more people are dying. That's an increased death rate.
Yes, 55% is a huge increase.
Ooh.
But the other bad news is that in Tennessee, the death rate has increased even more than that by 113%.
So this is the most important thing maybe for our viewers as we age, to learn why Alzheimer's is there and what we can do to prevent it. Tell me, what new is going on in the prevention and diagnosis? Let's talk about diagnosis. Give me an idea of what's going on. Why did I say idea?
Yes, I'm glad that you brought up idea or ideas. I'm the PI, or the principal investigator locally, for the IDEAS study, which is looking at imaging in dementia and screening for amyloid, or the protein that we find on autopsy in Alzheimer's disease.
So imaging would be x-raying or viewing some way, and amyloid is what?
Amyloid is the protein. Amyloid beta is a protein that we find on autopsy in Alzheimer's. We think it's the first protein to start to accumulate or clump up in the brain, causing damage to the brain cells.
So how early can that occur?
We think that amyloid accumulation occurs in our 40s and 50s and actually reaches peak by the time someone's having minimal symptoms. So waiting until your brain is maxed out with amyloid is not a great thing.
So if it starts at age 40 or 50, I might even have it, huh?
Maybe. I probably do too.
So if we have it, does that mean we have Alzheimer's? Do we know that amyloid definitely means Alzheimer's disease?
Well, there are some conditions where you can find amyloid deposition, and we all have a little bit of amyloid. In this particular case, in Alzheimer's, it's not just a little bit here and there, it spreads throughout the brain. And so what we're trying to do is, waiting until autopsy is not a great option. So there's a special imaging technique called amyloid PET.
So it's a special PET scan.
Yes.
So in positive emission
Tomography, yes.
tomography. And so it's special. Is it, what does it show? Just amyloid?
So what it does is that there is a tracer that tags onto the amyloid temporarily, and an individual will take the tracer via an IV and then go have the pictures taken with the CAT scan machine, and we'll see where it lights up.
When it lights up, what does that mean?
When the whole brain lights up, that is a positive scan. A small amount of amyloid deep in the brain is within normal limits. That's considered normal.
So it helps you know how bad the amyloid deposit is. Are there other, we'll get back to amyloid, beta amyloid in a minute. Are there other proteins that are going on, and what does the brain look like? Let's talk about a little bit about what's going on in the brain.
So the other protein that is involved in Alzheimer's disease, so we think of all of these different dementias as proteinopathies, a fancy way of saying proteins are clumping up, okay? So imagine things clumping up like a piece of crumpled paper. In the case of Alzheimer's, in addition to amyloid, next comes tau. As the amyloid accumulates, it starts breaking down another protein called tau protein. And the tau protein is kind of like the railroad ties on your railroad tracks. Think of the wires of your brain as railroad tracks. Tau helps stabilize those tracks. So when it starts to fall off and clump up, we have a neurofibrillary tangle.
So neurofibrillary tangle, that's one of the classic, that means the brain waves, the interaction there is becoming tangled up?
Yes, well, it's actually the tau protein itself. Think of the railroad ties piling up and clumping up and actually causing a cascade. Instead of just stopping there, it spreads along the tracks.
Wow, wow. And so the train's going to have a wreck, the person's going to have a wreck, everything is not coordinating itself well. So let's go back to understanding both beta amyloid and tau proteins, this proteinopathy, pathology of proteins, clumping of proteins. We can find it. How does that help us?
How does it help us? Well, in order to stop the disease, and I believe we will have a treatment, we need to detect the protein early. So this is why this particular study that is funded via Medicare is revolutionary. It's the first time we have widely available amyloid PET scans so we can detect amyloid in a live person. And if you know the protein, you know how to target that person and treat that person. So it's like waiting for a cancer treatment until autopsy. That's a bad idea. So here we can detect the amyloid and target the amyloid, hopefully earlier and earlier, to stop the disease. That's the goal.
So if you have funding as an investigator, what age are you looking for? At age 40, 45, 50, 55, 60? Anybody that forgetting things, because we all forget things, there are normal. So who are you looking for?
In this particular study, the cutoff is age 65. You have to be at least age 65 to participate, as it's funded through Medicare. But ultimately, in the future, I think we'll screen earlier and earlier, just like we screen for a lot of diseases at earlier ages. We don't wait for the symptoms.
Sure. Sure, so we screen for heart disease early, we screen for high blood pressure early, we do mammograms early, we do a lot of things. That's preventive medicine. Do you think there's a chance that if we find early that we can help prevent the illness by maybe getting rid of the amyloid early in life? What's your thoughts?
I believe that we will, especially for the right candidate. Some of the anti-amyloid treatments that are in clinical trial right now are very hopeful, but the key is to treat that person at a very early stage. Waiting for advanced stage is not a good option. So I do believe we'll have the disease-stopping drugs. In terms of when to start screening, I think that will be defined in the future.
Wow. Are we talking about 5 years, 10 years from now?
I think that we'll have a disease-stopping drug within 5 or 10.
I think that gives us so much hope. So 65, but I'm 45 or 48 or 50 and I want to know if I've got amyloid. Can I come and find out if I've got those special imaging procedures that tags the beta amyloid and will let me know if I've got amyloid in my brain at age 45?
So you can actually get these tests. However, you have to think about what that screening test does. So for instance, if every person got a full body PET scan or a full body CAT scan, we might find things that aren't really relevant.
Sure.
So First, you really need to have a good assessment to see, in fact, do you have memory problems? So if you do, and there's a strong family history, maybe that person should get earlier screening. But for the general population, I don't think that that would be a good use of time.
Monica, wow, that's really a lot of new things that are there. So when we come back, I'm going to want to talk a little bit about how we know early symptoms at age 65 or so, and what are the early symptoms, and how does medicine help people, and what are we doing about taking care of people with Alzheimer's? It's going to take you at least an hour. A lot of information. Wow. Stay tuned. We're talking with Dr. Monica Crane, board-certified physician, the head of Genesis Neuroscience Clinic in Knoxville. Monica, this has been a wonderful discussion. How long have you been working with Alzheimer's?
Well, I've been working in this field for 16 years. 16
years. So your knowledge of Alzheimer's is really wide. Let's get on with this discussion, because I have learned so much from you about the different proteins and how they cause the fibers to intertangle. Let's talk about some early, or even before somebody has dementia. What is MCI?
MCI stands for mild cognitive impairment.
So mild thinking problem.
Absolutely. And the wonderful thing about mild cognitive impairment is the individual that's having this syndrome is having some memory problems, is forgetful, maybe repetitive, but is still functioning very well. So it's an irritant at this phase, and maybe the family's really noticing this, but the person is still able to get through daily activities and still enjoying life. And so we really want to detect folks at this phase.
So how do we look for it? What signs are we looking for if somebody in the household says, uh-oh, I think my spouse or somebody in the house is having memory problems? What type of memory problems?
So what we're looking for is someone who's repetitive, maybe asking the same question over and over again, not 1 or 2 times, but maybe 20 times, or forgetting a grocery list and doing that repetitively. Many times we find that individuals in their occupation, if they're still working, do that with finesse, but struggle in simple activities.
So it's really activity that takes thinking, cognitive problems, that becomes obviously abnormal to somebody. Now, I forget the name of that restaurant that I ate at a week ago or 2 weeks ago. I just can't think. Is that Alzheimer's?
That isn't Alzheimer's. So there is a slowing of cognition with aging, and that's perfectly normal. As we age, we cannot multitask as much. And so if you're trying to do 5 different things at once, it becomes very difficult. And you will find that your attention is also diminished with aging, and that's also normal. So again, if you may think you have forgotten, but you probably just never learned it in the first place because of attention and trying to multitask.
So then you've got to look for more advanced things. You can't multitask, you forget some things, but that can be normal. When do you know it's abnormal?
Really, you need something else, some other objective evidence, meaning another piece of information. And so in our evaluation of mild cognitive impairment, we look for something called biomarkers.
So a biomarker, that means a living marker. Give me an example.
So it is an objective measure of pathologic processes or diseases. So an objective measure of disease. We use biomarkers in our everyday life. If you have a bathroom scale, that's a biomarker.
Sure, it tells me if I'm too fat.
But let's say if you had a particular condition and you suddenly gained weight, it could perhaps indicate there was something else wrong. So it's objective. And
what are some biomarkers that you look for, or that you can find?
One of the key things that we look for are imaging biomarkers. And one simple screen is a MRI or a CAT scan of the brain, where we look for areas of shrinkage or atrophy.
So there's shrinkage of the brain and atrophy of the brain as in Alzheimer's disease.
Yes.
That are having something to do with dementia. So what do you see in the brain on this imaging? That's interesting that you can find that.
So with normal aging, there is some mild global atrophy, but in early Alzheimer's or in mild cognitive impairment that will become an Alzheimer's case, we look for shrinkage of something called the hippocampus.
The hippocampus, where is that and what in the world is it?
So the hippocampus is a very tiny structure deep in the temporal lobe, and that's right above your ear area. We have one on each side, and it is the area that stores working memory. So,
So if something's going to go wrong with the hippocampus, you may not have a recall on the working memory. What does it look like on the brain? Does it get bigger or littler?
It shrinks.
So
it
it
shrivels. In Alzheimer's disease, it's very specific, and it's an area, think of it as a hard-working area of the brain, so it's under stress, and in Alzheimer's disease, it's really stressing it, and it tends to atrophy.
So you can look for the
Shrinkage.
hippocampus shrinking. What happens to the inside of the brain, the ventricles?
So sometimes you see enlargement of the ventricles, or the fluid areas increase because the actual brain mass has decreased. The other area that we look for shrinkage is in the parietal lobe, which is sort of towards the back part of the brain. And this area is important for processing, let's say, visual maps. So think of when we have perhaps lose something or misplace something, we have to retrace our steps.
Yeah.
And if the visual map of our brain is not working, you can't really find that map, and you can't walk backwards in time.
That's a beautiful description, because a lot of times when I'm forgetting something, I can say, now, where was I the last time I had this? And I go through my visual pathway. What's spatial problems? What is that spatial?
Yeah, that's part of the spatial problem. For instance, in that visual map problem, individuals that have mild cognitive impairment do just fine going to normal places, but may get lost going to places that they go to infrequently, because we are very good at doing those habitual things, like going from point A to point B, home to work, home to church, home to the bank. But if anything changes in that pathway, we get turned around. I don't know if you've ever been in the car where you've driven passively, you sort of arrive.
Yeah.
We're counting.
How'd I get here?
Yeah, exactly. We're counting on those areas of the brain to take us there. So if you damage those portions, you can't get there.
And so if I find myself not knowing if I came there in a car, or knowing if I had a car, or don't know where the car could possibly be, or if I have a car, that would be an abnormal sign.
Yeah, that would be an abnormal sign. Yeah, absolutely.
Unequivocally
Yes.
so. So when somebody recognizes that in the family, what's the importance of recognizing it and getting the biomarkers and the studies to see if they do have the diagnosis? Is there early treatment? Is there a reason we want to find it early? What can we do?
So we can do so much to slow down Alzheimer's. We think that there are huge risk factors. About a third of Alzheimer's cases are from 7 preventable risk factors. So we really want to implement healthy habits early, and many times maybe someone was resistant to smoking cessation, stopping smoking. This usually scares folks into smoking cessation. Or maybe someone is having a very poor diet. Many times Alzheimer's will scare someone into really changing their lifestyle.
So good lifestyle, like no smoking, exercise, watch what you eat, lose weight. Word games, do they help at all?
I think they help a little bit, but the key is exercising the brain. And if you really enjoy word games, and if it's coming easy to you, then it's probably not a good brain exercise. If it doesn't hurt a little bit, it's probably not a good brain exercise.
I'm going to talk later on that exercise causes neuroneogenesis, so it causes the production of, I'll talk about that in the close. So exercise and getting better lifestyle really helps maybe prevent. Does that help once you get it? Does it prolong? Are there medicines that can make you function better when you get the diagnosis?
Absolutely. So there are several FDA-approved medicines. One is called donepezil. There's another drug called rivastigmine and memantine, and they are slightly different drugs. Memantine is a different drug than...
What's the basic way those work? Because we'd forget those names.
Okay, those are fancy names, but
So what is
basically
it?
saying they all modify brain chemicals or neurotransmitters.
And so the doctor can tell what neurotransmitters are needed, and the medicines will guide toward functioning better, maybe memory better. Does that make it where it's easier on the family? I would think this is terrifying to everybody, knowing that they don't know what the future holds.
Well, I think that the key with the medicines, a lot of people say, oh, they don't work or they stop working after time, and that's not true. They never stop working. It's slowing the course of the disease and slowing the part where you're losing function. So we want to function high for the long period of time, and we want the very end to be very short. So think of it as slowing that slope of decline.
Monica, where is your office?
My office is on the Provision campus, 1400 Dowell Springs, Suite 100.
I don't know if I need to go or not. Sometimes I wonder about my thinking. If you want to worry about your thinking, know that you can look up Genesis Neuroscience. I just have to give you a plug because you're just so good, and you're just such a good teacher, and it's such an important thing in our society. Monica Crane, thank you for coming to the Dr. Bob Show.
Thank you so much, Dr. Overholt.
Wow, if that discussion couldn't be for 3 or 4 days, know that if you've got memory problems or you think a loved one does, that there are things that you can do. And if you find it early, there are medicines that can help you and you'll perform better, and the people around you can feel more comfortable that there's something that can be done, and social work will help you. We could go on and on. I want to thank Dr. Monica Crane. You're going to want to stay tuned. We're going to be talking about a wonder drug that fits right along with treatment of Alzheimer's and chronic sinus disease. Is it because there's something called dysbiosis, and what in the world does that mean? A lot of information for you. You'll want to stay tuned.
Dr. Bob and Dr. Crane will continue their discussion on Alzheimer's disease in a future episode. Stay tuned for the rest of the story.
I want to thank Dr. Monica Crane. Wonderful discussion on recent advances in Alzheimer's disease. Thanks, Monica. And now for questions from you, the viewer, that I think will be important to your health. Dr. Bob, I heard that the head of the CDC says there's a new wonder drug. Well, what he did say is when you go see your doctor for a checkup, he may write you a prescription for a new wonder drug, a new drug that you've been doing all your life, ever since childhood. Do you ever look at the beach and you see children, they just run everywhere? When as we get older, we jump up, we touch the top of the door, we never stop running. Phew, I wish I had the energy of my children. Well, we're talking about keeping that energy as we get older, and we're talking about brisk walking. And brisk walking is the new wonder drug, because we know that brisk walking does several things to help our health. It can cut down obesity and heart disease by 30%. If you start at a young age with exercise, every time that you go out and exercise, it cuts down the chance of obesity. It helps your heart. What is brisk walking? Well, brisk walking means walking at about 2 miles in 35 minutes or 30 minutes. If you're on a treadmill, it's about 2.8 or 3.0. It's walking to where you get a little short of breath, but you can talk to the person next to you, but you're really brisk walking. Before you do that, talk to your doctor about if you've got health problems that you shouldn't be doing that. But if not, get your tennis shoes on and let's go out for a walk. It will build new brain cells. New, neuro, brain, genesis. So indeed, studies have shown that new brain cells are formed with regular exercise. It puts out endorphins that makes us feel well. It increases collateral circulation in the heart. Get those tennis shoes out. 21 minutes every day is all it takes. 21 minutes. That's not even a half an hour. And that will give you enough walking in the week to where you'll be healthier. Your whole city will be healthier. In our area, we need that. It's so easy to do. I beg you, get out those tennis shoes and start walking. Question number 2, Dr. Bob, why can't people get well if they have chronic sinus infections? We're learning more and more about chronic rhinosinusitis. That means chronic sinus infections. If you've got a sinus infection, it probably shows up in the nose. We take antibiotics, it comes right back. Why is that? Why are we having problems? You need to find the underlying cause of blockage of the sinus openings. That can be allergy, that can be anatomy, that can be that a drainage area called osteomial unit is just blocked. The bacteria that get into the sinuses sometimes will form what we call a biofilm. That means the bacteria begin to multiply and they make a little circle of growth that blocks the antibiotic from getting into the inner part of the sinus. But what we wanted to mention today, that there is something called microbiome. That means the sinuses all have a certain group of bacteria that are always there. And if something interferes with that microbiome, like too many antibiotics or about changing activities, then indeed you may have dysbiosis. So talk to your doctor about seeing a specialist, specifically ENT, about chronic sinus infection and about how to get rid of that dysbiosis. We'll see if they know what that is. It's all the time that we have for this show. Remember the benefits of exercise, brisk walking. Remember, eat properly, more fruits, more vegetables. Google the Mediterranean diet. Make your diet good. No red meats or fried fatty foods. And that's the beginning. Eat less as the day goes on instead of more as the day goes on. Get 7.5 hours of sleep. It's so important that you get enough sleep. It'll make you feel better. It'll make the people around us feel better. And so be sure, if you're not sleeping well, you have to talk it over with your doctor. And most of all, what is it we like? It's giggling. It's laughter in your life. The more you laugh, the better you're going to feel and the healthier you'll be.
Dr. Bob and Dr. Crane will continue their discussion on Alzheimer's disease in a future episode. Stay tuned for the rest of the story. Dr. Bob and Dr. Crane will continue their discussion on Alzheimer's disease in a future episode. Stay tuned for the rest of the story.